Hello, I'm Christiansen, President of ACTS Retirement Life Communities. Welcome to our 20th episode of ACTS Vision, Our Journey Forward, filmed on June 2nd, 2021. As we have throughout the pandemic, we remain committed to keeping you well informed regarding the coronavirus and its impact on our communities through communication such as this and in our update letters to residents and staff. Since our last episode, there continues to be many encouraging signs in our battle against the COVID-19 pandemic. It has certainly been a long journey, but as each day passes, the optimism grows that we are making steady progress and getting closer to finally defeating the coronavirus and returning to greater normalcy in our daily lives and within our ACTS communities. In our last episode, I shared an update on mask mandates across our 9 states and described 3 mask protocols applicable to our communities based on various state requirements. Since that time, 2 additional states, New Jersey and Delaware, have lifted mask mandates, moving our communities in these states to Protocol Number 3, joining all other communities except those in Pennsylvania, where a mask mandate is still in effect for unvaccinated individuals. As a reminder, for Protocol 3, independent living residents in the states of Alabama, Delaware, Florida, Georgia, Maryland, New Jersey, North Carolina, and South Carolina do not have to wear a mask indoor or outdoor on campus, regardless of vaccination status. However, we continue to highly recommend mask wearing for all those who are not vaccinated. Residents who live in a Pennsylvania community will continue to follow Protocol Number 2 until the Pennsylvania mask order is completely lifted, which will occur on the earlier of June 28th or when 70% of residents in the state are fully vaccinated. In Protocol 2, independent living residents who are fully vaccinated do not have to wear a mask on campus, indoor or outdoor. Independent living residents who are not fully vaccinated must wear a mask in all indoor common areas and public spaces unless eating or drinking. Across all ACTS communities, vaccinated staff are no longer required to wear a mask except for those staff with continuous close contact with residents as part of their job duties. Currently, this includes culinary servers, beauticians, security officers, and all clinical staff members, including anyone who works in or enters Oak Bridge Terrace and Willowbrook Court. These employees and all unvaccinated employees must continue to wear a mask at all times within our communities and grounds unless eating or drinking. For visitors into our independent living areas, no masks are necessary upon proof of vaccination. All unvaccinated visitors must wear a mask at all times unless eating or drinking. As we welcome these continued changes to so many COVID rules and requirements, it has been so heartwarming to see full faces again and the beautiful smiles of our residents and staff as our campuses once again begin to bustle with activity and return to the traditional events and gatherings that we hold so dear. Further, thanks to the proven efficacy of the vaccines and the increasing rates of vaccination of residents and staff, we continue to have no active resident cases. Employee cases continue to be very low, and as of today, there are only 2 active employee cases. These low levels of cases are wonderful to see, especially with all of our communities being in Phase 3 of reopening for residents for several weeks now. Certainly, a major factor in our success has been our growing number of vaccinated employees, currently at 71%. Of our 26 communities, 19 have 70% or more of employees having received at least one dose of the vaccine. Another 5 communities are above 60%. In addition, we are delighted to report that since our last episode, the following communities, Park Point Village, Matthews Glen, and Normandy Farms Estates, have joined 13 other ACTS communities in achieving herd immunity amongst staff. Another community, Lima Estates, is also very close to reaching staff herd immunity as well. We are so grateful and encouraged by this level of participation amongst our staff and thank all who have participated in vaccinations. We continue to encourage those that have not been vaccinated to reconsider and schedule a vaccination appointment as soon as possible. Vaccinations are now readily available and have clearly proven to provide maximum protection and minimal, if any, side effects post-administration. As a reminder, similar to our flu vaccination policy, COVID-19 vaccinations for employees will be mandatory unless medically contraindicated or a valid religious declination is approved, upon full authorization from the FDA. If you have any questions regarding vaccinations, please do not hesitate to contact your executive director or nurse practitioner. We have multiple options for vaccine administration and will assist you in any way possible to obtain your vaccination. As we continue this week's program, I am pleased to have a new guest join us, ACTS's Vice President of Resident Health Services, Teresa Moore. As we continue to celebrate and share details of the reopening of our communities and changes to state mandates like masks and capacity limits, please be reminded that the rules and regulations that apply to Willowbrook Court and Oakbridge Terrace residents and staff are very different. Teresa will provide an update on the regulations that we must follow related to visitation, quarantine procedures, and other protocols. Please welcome Teresa.
Thank you, Karen. As the country has been reopening following the COVID-19 pandemic, and ACTS has been able to expand privileges across our campuses, I wanted to share with you how those changes differ for Willowbrook Court and Oakbridge Terrace. Both Willowbrook Court and Oakbridge Terrace are licensed and regulated by state and/or federal agencies that provide directives for daily operations. The Centers for Medicare and Medicaid Services, or CMS, is the governing federal agency for our licensed healthcare areas where our highest risk residents reside. CMS began lifting restrictions over the past 2 months. However, CMS remains cautious in moving too quickly given the vulnerability of the population cared for in these licensed areas. Visitation and group gatherings in Willowbrook Court and Oakbridge Terrace have been restricted for the past 13 months. In April of this year, CMS directed the expansion of visitation in skilled nursing and assisted living settings with additional privileges for vaccinated residents and visitors. The directive allows vaccinated residents to choose to have the close contact with unvaccinated family or friends while all are wearing masks. If both resident and visitor are vaccinated, close contact visitations such as hand-holding and hugging in private locations are permitted without masks. We are required, however, to suspend all indoor visitation with the exception of compassionate care visits and begin outbreak testing of all residents and staff regardless of vaccination status in Willowbrook Court and Oakbridge Terrace if a single resident or staff member tests positive for COVID-19. The positive test result must be reported to local, state, and federal agencies who often provide further direction to the community regarding additional quarantine or testing. Our protocol is to complete in-depth contact tracing on the positive or exposed person to determine potential exposure to individual residents or employees. Regulations require that any exposed resident or employee of Willowbrook Court or Oakbridge Terrace regardless of vaccination status, must quarantine as a precautionary measure due to the vulnerability of the resident population. We continue to monitor Willowbrook Court and Oak Ridge Terrace residents daily for signs and symptoms of COVID-19 and to screen anyone who enters either area for fever, signs or symptoms of COVID-19, or any known exposure to COVID-19. While we strongly encourage visitors to be vaccinated, which allows them additional privileges while on our campus, we cannot require it or make it a condition of visitation. In addition to expanded visitation, residents in Willowbrook Court and Oak Ridge Terrace may now dine or participate in group gatherings without masks if all are vaccinated. CMS no longer requires quarantine of residents newly admitted or those returning from a leave of absence if they're fully vaccinated and have had no known exposure to COVID-19. We are no longer required to conduct routine surveillance testing of vaccinated residents or employees. We do continue to routinely test unvaccinated staff on a frequency dictated by state or CMS regulations. Despite the lifting of mask mandates, CMS requires healthcare personnel to adhere to CDC's core principles of COVID-19 infection prevention, which requires face masks at all times while in the healthcare setting. These CDC recommended standards of practice apply to all healthcare personnel regardless of vaccination status. As part of our journey forward, we will continue to closely monitor and advocate for state and federal regulatory changes governing Willowbrook Court and Oak Ridge Terrace, and will make all allowable changes in our policies and protocols to provide our residents the safest and highest quality experience possible.
Thank you, Teresa. Next, we will be joined by Dr. Paul Reinbold, ACTS's Chief Medical Director, to answer questions we've recently received. Dr. Paul, will it ever be possible to eliminate masks for staff and visitors in Willowbrook Court and Oak Ridge Terrace?
There is currently movement towards recognizing vaccinated status when considering the need to mask in Willowbrook Court and Oak Ridge Terrace, just as there has been outside of these areas. Additionally, it should be noted face shields, eye protection, have been required for staff for direct patient care in addition to masks in these neighborhoods as dictated by individual states. ACTS continues to advocate in coordination with other groups to make the rules for these areas consistent with the science. This would include eliminating the requirement of masks for both visitors and staff that are fully vaccinated. Similarly, face shields likely should not be necessary for those that are fully vaccinated unless performing a procedure that would generally require this protection. We will promptly communicate any changes as they occur.
Why is the CDC no longer following mild breakthrough COVID-19 cases?
Breakthrough cases are COVID-19 infections that occur after full vaccination. As we have previously reported on our journey forward, these cases are rare. The CDC has expanding data now involving over 100 million fully vaccinated U.S. citizens and has recognized that the vast majority of breakthrough cases are mild and uncommon. Therefore, going forward, the CDC intends to only monitor breakthrough infections resulting in hospitalization or death. The likelihood of death from COVID-19 after full vaccination remains exceedingly rare, occurring in only 1 in a million cases. This compares with an actual realized mortality rate in this country of approximately 1,800 COVID deaths per 1 million cases prior to the availability of vaccinations. This dramatic difference illustrates that these vaccines are truly a wonderful blessing.
Is it true that booster shots may not be necessary?
Exciting research results from recent studies suggest that the immune response may be sustained for greater than a year in those that have had COVID-19, as well as for those that have been fully vaccinated. For those that are recovered from COVID-19 and are fully vaccinated, an even more robust immune response has been noted, suggesting the possibility of lifelong immunity. This longevity is related to the human body's ability to continue to produce antibodies, including new antibodies going forward, in response to previously recognized threats. There is a memory in cells that persist in the bone marrow that allows increased production of antibodies by these cells, and an ability to stimulate this response in other white blood cells if re-challenged by the virus in the future. These findings are certainly a welcome surprise.
Do messenger RNA vaccines cause myocarditis?
Recent reports have suggested cases of myocarditis, heart muscle inflammation, and pericarditis, inflammation of the lining around the heart, in those having recently received a messenger RNA vaccine. It is not clear that there is a causal relationship, given that there are many causes of myocarditis and pericarditis, and these illnesses occur in the general population at a frequency very similar to that noted in those vaccinated. Cases have occurred mainly in young males older than 16 after the second shot and have been mild without significant consequences. Most have resolved with standard treatments, including the use of anti-inflammatory medications. The CDC continues to monitor these cases, but has not given any cautions regarding continued use of these vaccines, other than to notify clinicians to be aware of these possible diagnoses and to report occurrences and to treat accordingly. It should be noted there has not been an association of these cases reported in those receiving the Johnson & Johnson vaccine.
Since the Johnson & Johnson vaccine pause has been lifted, have there been further issues with clotting problems or new adverse events noted?
Since use of the Johnson & Johnson vaccine was restarted, it has been used successfully without evidence of further major clotting issues or new adverse events. It is likely being used less often in females younger than 59, given that group appeared to be most at risk for the clotting events. Outside of this group, it remains a valuable vaccine with strong protective benefits outweighing any risks based on ongoing data and guidance from the CDC.
Thank you, Dr. Paul. And thank you for watching this week's episode of AxVision, Our Journey Forward. We appreciate your patience as we continue on our journey forward and taking steps in safely returning to our pre-pandemic activities, services, and programs. We ask that you please continue to send any questions you have to your executive director so that they can be addressed in future episodes of Our Journey Forward and our monthly update letters. Thank you, and may God continue to bless you, your family, and the entire AX organization.